Hi, my name is Caitlin Cantu, and I will be doing my presentation on autoimmune disorders and why it is challenging for physicians and clinicians to diagnose them. Let's get started. Why is it challenging for clinicians to narrow down the autoimmune disorder at play, and how is it diagnosed in the end? There are many reasons why it can be challenging, but for clinicians to narrow down the autoimmune disorder at play is due to a large number of options, variability of symptoms, and the fact that signs and symptoms can take a long time to fully develop and may change over time. The diagnosis often involves detecting self-reactive immune system cells and/or autoantibodies, which are antibodies that bind to self-tissues. Depending on the suspected disorder, the clinician may also order other hematological tests, blood tests that look for specific inflammation and metabolic factors. An autoimmune disorder is rarely definitively diagnosed using a single test. Instead, a collection of tests and careful assessment of signs and symptoms are required. So some autoimmune disorders have scoring criteria to help clinicians make a diagnosis. As a generic example, if the patient met 5 out of a dozen criteria for a particular disorder, then he or she might have an 85% likelihood of being affected by it, based on historical data. Typically, the more criteria a patient meets in such a scoring system, the greater chance of the diagnosis is actually accurate. So let's move on. So, autoimmune diseases. There is a list of what's considered to be autoimmune, and it is long and it ranges from very common to extremely rare. So I did not know this, but if you did, the following are all autoimmune diseases: celiac disease, diabetes type 1, multiple sclerosis, MS, psoriasis, inflammatory bowel disease. I did not know any of those were autoimmune diseases, but they are. And I know multiple sclerosis is a type of nerve disease, I believe. Psoriasis, I know that has to do with the skin. Rashes, very bad looking rashes. Diabetes type 1, I did not know that. So these are all types of autoimmune diseases if you did not know. So while all of those diseases are very different, they all have one thing in common, which is they occur only when a person's immune system decides to attack healthy body cells instead of fighting an infection with antibodies. So the body produces autoantibodies. So basically the body is essentially fighting itself and not. The typical symptoms in these earlier, less acute stages, so the symptoms include fatigue, aches, rashes, swelling, difficulty concentrating, and slight fevers. That's not much to doctors in narrowing things down because any autoimmune disease, and indeed a wide range of other common conditions, can cause any or all of these symptoms. But there are factors that should cause doctors to want to consider an autoimmune disorder as a possible option. So if symptoms persist, there are no apparent other reasons for why they keep persisting, then it's time to wonder if something more is going on, such as an autoimmune disease. I have provided my works cited for you. That is all I have for today, so thank you for watching. I hope you have a great day. Thank you.